Carlos Icy with ESPN LA, proud to be joined by Dr. Alan Bayer, board-certified orthopedic surgeon at Hoag Orthopedic Institute. Dr. Bayer, we got a great story to talk about today.
Yes, we do. I mean, this is becoming a regular thing. We've got lots of things to talk about lately.
A legend in not just Dodgers baseball, but MLB history, Clayton Kershaw, surprised us with an announcement on Instagram announcing that he had surgery. And I'll go ahead and read the post. This morning, I underwent a surgical procedure to repair the glenohumeral ligaments and capsule of my left shoulder. I'm thankful for the expertise of somebody we talked a lot about on the road to recovery, Dr. Neil Elitrash, who
Our good friend.
Exactly. Who performed the surgery. I am hopeful to return to play at some point next summer. Thanks for your prayers. Dr. Bayer, you saw this post. What you first think?
My first question was why? I mean, Clayton Kershaw has a career that spans 16 seasons, far greater than the average length of career in a professional baseball player, especially a pitcher, right? The surgery that we're talking about here, which is a reconstruction of the soft tissues of the shoulder, this isn't a rotator cuff injury. This is the tissues that hold the shoulder in the socket. So he's obviously been plagued by a bit of instability in his throwing shoulder. The shoulder is a little bit loose in the socket, not completely dislocating, but what we call subluxing, which means partially coming out of the socket. So this is due to stretching out over a period of time of the ligaments and capsule that hold the shoulder joint together. So he had that surgically reconstructed, which means basically tightened back up to render the shoulder more stable. After a 16-year career, one would say, well, why have this operation unless you're planning on continuing your baseball career? So clearly, Clayton Kershaw is planning in his head to see if he can continue his baseball career. We're much better with you and I have talked so much about Tommy John surgery and ligament surgery of the elbow. We are far ahead of the elbow in our treatment of shoulder problems, rotator cuff, instability problems like this. One of my mentors, Dr. Frank Jobe, really wrote the book on the shoulder, especially in pitchers back in the 70s. I mean, he just researched and invented everything we know about the shoulder in pitchers. And obviously Neil works at Kerlin Jobe now, so he clearly is a disciple of Dr. Jobe's, as I am. So Frank described these surgeries to stabilize the shoulder, to render it more stable and not partially come out of joint when you're throwing a baseball. I don't know how many of our viewers and listeners or you have seen slow motion video of what happens to a pitcher's shoulder during throwing a baseball, and it's absolutely phenomenal how much the shoulder gets maximally externally rotated and abducted and stretched during the normal pitching maneuver. So it's clear that after 15 or 16 years, these tissues do stretch out and lose some of their integrity. And the purpose of this surgery is to restore the integrity of those ligaments and capsule to make the shoulder more stable. As I said, clearly Clayton Kershaw plans on continuing pitching, because if he didn't, I don't think he'd need to have this operation to play ping pong or to play golf. But in his mind, he thinks he still has a window that's still open, and that somebody, if not the Dodgers, is going to consider him useful in their pitching rotation next year. The downtime for this kind of surgery is usually about 6 months. So he conceivably could be throwing by spring training somewhat gently, maybe throwing 100% by opening day or a month or so later next season. So it's conceivable he's available as of next year if somebody feels that they need him. And the way things have gone the last couple of years, you can never have too many pitchers. I mean, pitching is a team can't have too many pitchers. The question is, how many pitchers can they afford? And how much is Clayton Kershaw willing to sign for to continue his career?
Yeah, like you allude to, Dr. Bayer, Clayton Kershaw is a free agent pitcher. It's going to be amazing. An amazing MLB offseason, of course, with the Shohei Ohtani race. But Kershaw is one of those names, as well as a lot of pitching arms that are going to be so much more valuable for teams to target. But we're talking about Clayton Kershaw, of course, a soon to be Hall of Famer, but a 16-year veteran. You mentioned a 6-month recovery. Can you really apply a 6-month recovery to somebody who's been in the league pitching that long and has had his own share of injuries as well?
That's a great question because in addition to these ligaments stretching out over time, clearly the stress that 16 years of pitching at the major league level puts on the throwing shoulder, he's got to have some level of degenerative disease in that shoulder, more than we see in a 36 year old who doesn't throw a baseball. So there's clearly an element of some degenerative disease in that shoulder. How much will that impact his ability to go back to throwing after the shoulder's been reconstructed and stabilized? I don't know. I don't think anybody knows the answer to that until you see. We get away with degenerative disease in the shoulder a lot more, a lot better than we get away with degenerative disease in the knee or the hip, because the shoulder is not a weight bearing joint.
Hmm.
You're not putting force on the shoulder. Obviously, pitching puts force on the shoulder, but it's not weight bearing force. So, an arthritic knee or an arthritic hip is going to slow a player down much more than mild arthritis in a shoulder, a non weight bearing joint. So, the question is just going to be A, how much arthritis was there in there when Dr. Elatrosh attacked this? B, interestingly enough, when you tighten up a joint that has some arthritis in it, sometimes the arthritis becomes more symptomatic because the joint is now tighter and you actually get more arthritis pain. So even though the shoulder is more stable, it's more painful because you put more tension on it because it's now tighter. So this is all, we'll see. Que sera, sera. We'll see what happens and how he responds to the surgery that was done.
So you're saying there's no way that Clayton Kershaw felt like he had to do the surgery for relief? There is still that chance of that it could cause more stress?
This isn't a surgery that you have for pain. This is a surgery that you have because the shoulder's unstable.
Mm.
Um, to live his life, if Clayton Kershaw was ready to hang up his cleats and start the countdown till when he's in the Hall of Fame, which is he will be in as soon as his time comes, as we both know. I don't know if you would have had the surgery. As I said, a slightly unstable shoulder doesn't preclude you from doing almost everything in life except perhaps throwing a baseball at the major league level. So um, clearly, Clayton Kershaw is considering continuing to be a major league baseball player.
Dave Roberts, he was talking about maybe 3 months before the end of the regular season, his concern already in Kershaw's uh, throwing motion and how he was losing like 10 miles per hour on his pitches. The velocity was decreasing dramatically. So we were seeing already an impact that may have been caused by the shoulder. Will we see those numbers recover, him get back to some sort of Clayton Kershaw that we've seen before, or is it just for the longevity of him to continue his pitching career?
So hopefully, yes. Hopefully that decrease in velocity that Dave Roberts alluded to in that last couple of months was due to the fact that he was pitching with a shoulder that was a little unstable. It was a little bit loose, and that's why they're hypothesizing that he lost some of his velocity. And if the shoulder is stabilized, yes, the hope would be that he would be able to regain that velocity. That said, as I said before, it's a shoulder that's seen 16 seasons of pitching at the major league level. You can fool Mother Nature, but you can't fool Father Time. And, there's very few sports that guys last 16 years, if you really think about it. So I think that obviously our hopes and thoughts and prayers are that he does regain the form of old. But like a LeBron James, for instance, he has a lot of miles on the odometer, and you can't roll that back. So I think we're just going to have to see how his body responds to the fact that the shoulder's been stabilized.
Dr. Bai, what signs are you hoping to see if and when Clayton Kershaw returns at some point next season to ensure that, okay, the surgery did help and he may be able to play a year, finish out the year, maybe a second year?
I think that once he's fully rehabilitated and gets back his strength and is throwing at his normal full tilt, the radar gun's going to give us that answer, isn't it? The Dodgers aren't going to take him back if he's still 10 miles an hour slower on his velocity. 80 something mile an hour pitchers are not big successes usually in Major League Baseball. So it's going to be kind of like, what does the radar gun say after his rehabilitation is completed?
We've talked about it here on ESPN Los Angeles. Clayton Kershaw is infamous as a postseason pitcher, doesn't have the same success in the postseason as he does in the regular season. Could you see it, not just from a record or history of performance perspective, but also from a health perspective? Could you see him get held out in the regular season for a push that is more towards the fall?
That's a great question, and that's going to be up to the management of whatever team he lands at. I certainly think that because of his age and the mileage on his arm, that adopting kind of a Shohei Ohtani-ish schedule, where it's maybe every seventh or eighth day, not every fourth or fifth day, if he's back in the rotation, to accommodate the fact that you want to keep some gas in the tank for the end of the season, because I know he sure as heck would like another opportunity to improve his postseason statistics. I mean, I think his postseason ERA is a full 2 points higher than his regular season ERA. I'd hate to see a guy with a career like this be remembered for the fact that he didn't have a stellar postseason, career in terms of numbers. But that said, that doesn't diminish what he did in the regular season for 16 years. I mean, this guy's he's a great pitcher. If he never throws another ball in a major league ballpark, this guy's a great pitcher. We can't forget that. But, fans are fickle.
One thing I would like to forget, and I'm still trying to forget, is his last outing, that embarrassing start in Game 1 against the Arizona Diamondbacks. But um, going back to the weekend warrior, our fans who are watching the road to recovery, how often or what kind of instances have we seen an injury like this in the normal person?
You see it in not in a lot of normal um, weekend warrior pitchers. They're not throwing as often as a professional pitcher. They're not throwing with as high velocity as professional pitcher. You do see these kinds of instability issues. Interestingly enough, more in females than in males. Volleyball players, swimmers, other activities where it's an arm overhead activity and the shoulders really put in a maximal position of rotation, and if their tissues are somewhat ligamentously lax, and females are somewhat more ligamentously lax than males, part of that's hormones, part of that's collagen. There's a zillion reasons for that. You do see it in overhead athletes, not just baseball. So volleyball comes to mind, swimming comes to mind, and it's not that uncommon. It's a surgical procedure that we've gotten very adept at in the last 30 or 40 years, but typically the average volleyball player or swimmer who has the surgery is in their 20s, not 36 with 16 seasons in under their belt.
Dr. Bauer, you mentioned collagen. There's supplements that you can take for collagen and for treatment to strengthen your joints. What other treatments would you recommend those who do feel shoulder pain, and what can they do ahead of time and be proactive and avoid a surgery?
I think the most important thing that our weekend warriors who are watching and listening to us can do to preserve their shoulders isn't a nutraceutical, isn't something to take by mouth. Most of those things are broken down in your stomach by your stomach acid anyway. The most important thing you can do, and I'm going to harken back to Frank Jobe once again, is a vigorous program to keep your rotator cuff strong and balanced. A really sound rotator cuff strengthening program. And this isn't just building up the muscles that we always think of around our shoulder, the biceps, the triceps, the lats, the pecs. This is the small muscles of the shoulder, the internal and external rotators, the supraspinatus, the infraspinatus, the subscapularis, the muscles that most lay people don't think of when they think of strengthening their upper extremities. So the key is to find, either from your physician, physical therapist, trainer, whomever, a good program aimed at maximizing the strength of your rotator cuff. keeping your rotator cuff strong is the best insurance policy against any of these problems.
Dr. Vire, on behalf of many other athletes who are watching this, thank you very much for that advice. Let's have some fun on our way out before we take an exit on the road to recovery. Dr. Vire, Clayton Kershaw in April of 2024 is
Recovering pitcher,
wearing a
Texas Rangers uniform.
hot take, Dr.
I
V.
I think the Texas Rangers might be, especially if the Dodgers land Shohei Ohtani, which right now, if you believe the scuttlebutt on the street, looks like they're in the catbird seat. I think Clayton will probably play, but I don't think he'll be with the Dodgers.
Wow, that would be shocking to see. Take a while for us to get used to seeing Clayton Kershaw in another blue shade of blue, but we'll see. Dr. Byer, thank you very much again for joining us on the road to recovery.
Always a pleasure. And remember, Saturday, 12 noon, Angels Radio, AM 830, KLAA, Doctor in the Dugout. We're on all through the year, not just baseball season. So Saturdays, 12 noon, tune in and hear what we've got to say.